Hey guys, this is Dr. Hub. Today we'll look at the infant nevirapine prophylaxis. So in terms of the birth weight being less than 2000 gram. So in this case, what is the NVP daily dose? So the daily dose will be about 2 mg per kg and it is given once daily into 1 daily. So what is the NVP daily dose in ml? In ml it is going to be 0.2 ml per kg and this is once daily. Next is the birth weight of 2000 to 2500 gram. So what is the NVP daily dose? NVP daily dose in mg, it is 10 mg once daily. And next is greater than 2500 mg. So before we go here, the NVP daily dose of the 2000 to 500 gram, this is going to be 1 ml once daily. Now we are going to the age group of greater than 2500. So greater than 2500 gram, the NVP dose is going to be 15 mg and this is given once daily. And what will be the NVP daily dose in ml? In ml it is nothing but 1.5 ml once daily. So when you look at duration, it is up to minimum of 6 weeks. So it's 6 weeks minimum and it can be extended to the 12 weeks. So it can extend to 12 weeks if the duration of the ART in pregnant mother falls short of 4 weeks during pregnancy. So it can be extended to 12 weeks if the duration of ART. So the ART duration in case of a pregnant woman falls short of 4 weeks. So in a pregnant woman, it falls short 4 weeks and this will be during pregnancy. Next is if the mother is not already on ART during labor. So in case they are not already, mother is not already on ART during the labor.